We're going to shift gears a little bit in the theme of the presentations now, and we're going to be fortunate to hear from a patient and his family. I'm going to introduce Doug Selmont and his wife Lindsey to come and talk to us about their experience with PMP. But before I turn the microphone over to them, I just wanted to, for anybody who was here last year, if you remember, we had a wonderful presentation from Andy Noel and his sister, Michelle Feck. And unfortunately, Andy and Michelle couldn't be here today, but their parents are here today. And I just wanted to give you an update that Andy is doing very, very well. He spent 3 weeks out west with his family this summer, and he's back to work. And I heard that he just recently rode 85 miles in a fundraiser for the Smilo Cancer Center down in Connecticut. So all of you who remember Andy, happy to let you know that he's doing great. And he's coming up in another couple of weeks for our cancer walk here as well to help raise money for cancer research. So with that, I'm going to... introduce Doug and Lindsey, and we're so grateful that they could be here today.
Hello? Oh, I'm on. Hi, I'd like to welcome everyone here. First off, I'd like to thank Dr. Lambert for hosting the event for us. This is really wonderful. I didn't expect to see this many people here. Second, I'd like to thank the Research Foundation because, like Jim said, when he asked me to do this last Thursday, I was thinking about it. I wasn't really sure if I could come, first of all, because of work obligations during the weekday. But, then I sat down that night, and Lindsey actually came home and said to me, Sunday's a big day for you. And it didn't click immediately. So I kind of looked at the calendar, and Sunday was actually 4 years to the day since I had cytoreductive surgery with the HIPEC. So in thinking about that and where we've come and where we started, I really knew that the best thing I could do would be to come share all of our experiences with you. So thank you to the PMPRF for giving us this opportunity. Thanks to the rest of the panel. And I guess we'll start with a diagnosis story. It's ironic. Lindsey and I had been dating for about a year. It was spring of 2008, and I had for a while some pain that came and went. Thought for a while that it was, from lifting weights. I was in the best shape of my life. I was getting ready to run the Hartford Marathon, and I would have these pains and they would go away. And thought, if you don't think about it, it goes away and never comes back. But something in the back of my mind told me it's not going to go away. So, we had just moved in together, and Lindsey was scared to get her cholesterol checked. So I came home one day and I said, you have to get your cholesterol checked. It's very important. And she said, well, you won't get your stomach pains checked out, so why should I get my cholesterol checked? I said, I'm going to go to the doctor about my stomach pains to prove to you that there's nothing wrong with going to the doctor. And boy, did that backfire. But at the same time, we got very lucky. It also coincided with our first trip to the Cayman Islands. I was actually diagnosed over the phone on the beach in the Cayman Islands. So if you're going to hear some news, there could be a lot worse places to hear it. So that was diagnosis. I'll let Lindsey.
Well, okay. This on? Okay. So from I'm here kind of to give just the family and caregiver perspective. Over the past 4 years, I've kind of had a lot of different roles. I've been girlfriend, caregiver, wife, cheerleader, secretary, lots of different things here. So, as far as diagnosis is concerned, like Doug said, we had just been dating at the time. We had just moved in together, and it was blood pressure, not cholesterol. So we were just learning how to be a couple. that me? Just learning how to be a couple and be together and, you know, kind of figure things out from there. And then we kind of had this big, this is better. Is this better? Okay. Okay. So like I said, we were just kind of learning how to be a couple, how to be together, and then we kind of had this thing happen to us. And, you know, this was something that neither one of us had very much experience with. We were 25 years old at the time. You know, I was trying to figure out how I was going to get him to, you know, clean up his shoes and his dishes from the kitchen, you know. And then all of a sudden we kind of had some new experiences coming our way. So I'll kind of let Doug go over what happened next in this whole journey.
After we returned from the Cayman Islands, after we came back from the Cayman Islands, we sat down with my primary care physician. I was actually one of the rare instances where I hadn't had any prior surgeries. I hadn't been touched. I was a blank canvas, really. And a radiologist who had never seen the disease before, you know, magically, you know, they say, I'm 1 in a million, quote unquote. It must have been 1 in a million for this radiologist to correctly identify me with pseudomyxoma peritonei, which in the end wasn't the correct diagnosis, but at least set us out on the right path. So my primary care physician, who I had seen for the past 15 years, you know, sat us both down and said, you know, I got to be honest with you guys. I've practiced medicine for 20, 25 years, and I've never seen this before. So I don't know. But luckily, I have this intern medical student at Yale, and he did some research for you. And he walked in with a stack of papers about this big that he printed off the internet. And so he's telling us this. You know, we didn't know, was it cancer? Wasn't it cancer? The definition wasn't really all that clear to us. So we knew it wasn't good, but it didn't mean it had to be bad either. So we took that information, went home, and started flipping through the pages. And, you know, the common theme we saw was this Sugar-Baker method of treatment, the cytoreductive surgery with HIPEC, and, you know, a bunch of names kept popping up. This was before we really were interested in finding all the information on the internet. We had a stack in front of us, and the names of Dr. Sugar-Baker, Dr. Sardi in Baltimore, Dr. Lambert while she was at MD Anderson, all came up. So our next step was to take a deep breath and start making some consultations. So we made consultations because we were on the East Coast. We made consultations with Dr. Sardi, Dr. Sugar-Baker, Dr. Bartlett in Pittsburgh, and we figured just for the hell of it, we would go to Sloan Kettering too, because when you hear the word cancer and you're in Lower Connecticut, the first thing you can think of is to go to Memorial Sloan. So that was actually our first consultation. We met with one of the heads of gastrointestinal surgery there, Dr. Daniel Coit, who walked in. You know, and at that point for me, it really hadn't hit home yet. I don't know that I was living in denial, probably more ignorance is what I would call it. Everyone else probably called it denial. He walked in, and we had sent all my pathology slides, and, you know, he started talking, and he took a break for a second, and me, probably not having the right sense of decorum, said to him, so here's where you tell me that it was all a big mistake. And he turned around and matter-of-factly said, you know, Doug, there is no mistake, but, you know, we're going to find someone to take care of you. And so from that point forward, you know, I realized I didn't want to be glossed over to. I didn't want people to talk to me like I didn't know what was going on. I wanted the truth, and I wanted honest opinion. And although we didn't end up going with Sloan Kettering, you know, I give Dr. Coit a lot of credit because he said, we do not do that type of surgery here. He was very politically correct about it. He was actually the one who referred and suggested that I make an appointment with Dr. Bartlett in Pittsburgh, which I did after that fact. But he said, we will help you, but it's going to be a series of serial debulkings. a lot of chemotherapy. I think I can do a lot for you, but considering your age and the things you want to do with your life, I think you really need to talk to these doctors. So that was Sloan. I don't know if you'd like to give your opinion on that.
No, I mean, one thing I will say as, coming into this new journey is I think both Dr. Lambert and Dr. Pingpeck kind of referred to the internet it's both a blessing and a curse. There's so much information out there. A lot of it can be very scary. So when doing the research, that was one thing that really sticks out to me is, there's so many different opinions out there. There's so much information. Wading through all of it can be a really daunting task. So to have medical professionals that you meet with, whether or not you end up going with them like we did with, or like we did not end up going with Memorial Sloan Kettering, just having those kinds of opinions and that kind of guidance really was a big help for us. And as Doug will walk you through, how he selected his surgeon and kind of what happened from there, you can see how much that communication and how much the relationship with the doctor, with the hospital, with the whole staff really makes a difference in care and how you approach it.
Yeah, after we left Sloan, I think our first decision probably on the train ride home was we're going to go big. At that point in our lives, you go big or you go home. We didn't want to, for me, looking at it, I had a lot of personal conversations in my own head, just because how could I do this to her? How it was guilt already, but the decision for me was in 10 years, 5 years, I don't want to look back and know that I took an easy route. I want to know that I did everything I could to do the best I could with this disease, and for us that was the cytoreduction and HIPEC. So we went home and we made consultations, Dr. Sardi, Dr. Sugarbaker, and Dr. Bartlett. In talking over the phone to Dr. Bartlett and Dr. Sugarbaker, I met with them after Dr. Sardi. Dr. Bartlett's office was great. I only had phone conversations, but they wanted to see me on a Friday and operate on a Monday, and I wasn't mentally prepared for that yet. And as much as I believe in medicine and science, and I do science in my everyday life, I needed some time for myself. I needed to come to grips and be emotionally ready. I was physically ready, but my mind had to be there too. So we set the appointment with Bartlett last. Ilsa Sugarbaker and I spoke on the phone many a time. That was in the middle, but I happened to be going a couple weeks later to Baltimore for business. So I scheduled a consultation with Dr. Sardi there. And this was a big deal for me. I was very, very scared, didn't know what to think. Sitting there in the waiting room, he's not the most punctual man with consultations. And in 4 years, I know why. It's because people have a lot of questions about this disease. People have a lot of questions about the surgery, and they should ask them. And if I have to wait because somebody else needs an extra half hour to be comfortable with him, I'm fine with that. At the time, I wasn't, but now it's much easier. I met with Dr. Sardi, and within a minute, I probably knew that I had my guy. There was a connection. He was honest, but passionate, as all these doctors are. Like Dr. Switzer said, he says he gets laughed at the colon cancer conventions for our low numbers, but it's a thankless job, and the dedication they show is amazing. So he said, we're going to help you out. This is Dr. Sardi. But I want you to be ready. I'm going to do everything I can. And that day, him and I promised each other. He promised me that he would do everything he could to help me out, and I promised him that I would do everything I could to help him out. So, with that, I didn't book the surgery date, but I knew I had it. Walking out, I canceled my other 2 consultations and then gave Lindsey a call on the phone.
So as a caregiver, one of the hardest things that I think I had to learn how to deal with was to step back, let him decide when he was ready to do things, because it's very easy to be a caregiver and say, hey, did you call and make that appointment for that, little surgery thing you're going to have done here? You need to get that on the calendar. And, so to learn how to step back and let him come to the decision on his own as a caregiver, I think when it comes to all facets of treatment, there are times when you have to push and there are times when you have to pull back. And this was one of those times when I had to pull back, let him come to the decision, and he did. So that was definitely a learning experience for me and for any other caregivers in the room. They can probably understand that, or if they have something like this coming up, just a word of advice is that's one of the more difficult things to determine is when you do have to push and when you do have to kind of step back and let the patient make the decision that's best for them. Because being in a mental place that's good is almost as important as being in that physical place that's good. So.
All right, so now that we had our surgeon, we had a little bit of a wait. I wanted to enjoy my summer before surgery. I wanted to celebrate my birthday. I wanted to have my fantasy football draft. And then I was ready to go in early September. So, we drove down to Baltimore. I was very clear. I didn't want a lot of people around. I have a lot of pride, and I knew I was probably going to be in rough shape for maybe a day after surgery, or more like a couple weeks. But I wanted Lindsey there, my father, my stepmother, and my brother, and that was it. I wouldn't have gotten away with allowing any less, but I definitely didn't want any more. So we checked into Mercy Hospital. Initial morning of surgery, I was fine. I was in a good place. I wasn't nervous at all. I knew I was doing what I had to do. And that was a key for me. Even getting up to walk to the operating table, I was 100% calm. I had every faith in the world in Dr. Sardi, and he had every faith in the world in me. It was later we found out that, my PCI score was, at the time of surgery, a 39, which I believe the scale's out of 39, and if the scale were out of 60, it would have been a 60. So, it was tough. I had a lot of disease, especially considering my age. It had progressed very, very far. We knew that the day beforehand, initial CAT scan that day before. Dr. Sardi, was more than worried that he wasn't going to be able to perform the surgery, but he promised me that he would try, since I promised him that I would try. So under that agreement, and I'm sure a lot of laws and stuff he abides by, we went forward. And surgery day was a quick day for me. I was asleep the whole day. So that's what I have to kind of turn it over to Lindsey because,
Yeah, the day, that actual day is a lot easier for the patient than it is for the caregivers and the families. It's the days afterwards where really, the patient is really, you're making up for those 18 hours that you're under. So it was a 14-hour wait from when we said goodbye in the morning to when we were allowed into the recovery room at night. We would get periodic updates from the nurse who was in the operating room, but she told me right from the beginning, she said, the only thing that I'm going to give you is that he's doing okay. She said, don't ask me any questions because I'm not going to answer them. She's like, I need to get back and make sure that everything's okay. So, we would wait, every 4 hours or so we would get the phone call and they would say, he's doing okay. And that was it. So it was a long day for sure. But I mean, with that constant communication, again, coming into play as being comfortable with the team, with the staff, we were the last people in the waiting room, that night. When Dr. Sardi came out to talk to us, you saw him and you felt like all was kind of right with the world. And that's just the relationship that we had and the comfort level that we had, I think, so.
Post-surgery, I mean, you can't lie. It wasn't easy. There was a lot of pain involved. For me, the biggest issue, which I brought to the attention of Mercy medical staff because they hadn't seen it, I'd had about 20 liters of fluid pumped through me during the 14 hours. And because, I am a smaller guy, that pressure built up and caused me incredible nerve damage in my hands. So I noticed within about 3 days of surgery that my hands were burning. I couldn't use them. I couldn't do anything. And this was a side effect, or I guess a morbidity, to use a word that we're all trying to learn here, of the surgery that they hadn't expected. That was harder for me than the pain tolerance. I mean, that's probably just personal. But walking, getting up, moving around, having visitors come down, it was a good experience. It was, other than the hand part, was much easier than I actually expected.
So it was 11 days in the hospital. 1 week afterwards, we stayed in a hotel across the street from the hospital. As a caregiver, again, one of the scariest things is when they say, sure, you can go home. And then you realize that you've got this guy who's just been basically run over by a truck, and you don't have the nurses there. You don't have the call button. What do you do? So it was nice that we were right across the street, but it wasn't, that's the scariest, is when you walk out and you say, oh my goodness, now it's just us. So that was another, I think, big step for us. So after the 5 days, we were in a hotel in Baltimore. Finally, we were given the clearance to go home. And I don't know about you, but that was one of the best homecomings, I think, ever. Was just driving up. We saw our cat, and Doug got to sleep on his own bed, sit on his own couch, and that was the kind of the first steps on the long road to recovery.
Yeah, and I mean, next we'd just like to talk about post-surgery, challenges faced, obstacles we've overcome. I wasn't able to have a full cyto reduction, unfortunately, but he got a very large amount out, enough to continue and do the hypec. But the area he had to leave in was around the emptying of my stomach, around the duodenum. So about a couple years after the surgery, it started restricting, and I started with an inability to keep food down. So I've had so far 3 stents placed to keep that open. But through this process, we were able to learn. One of the keys to having this disease is obviously early detection, but early detection of problems you have afterwards, on top of being your own best advocate when you're at a hospital that's unfamiliar with what you have. The second time I had a stent placed, because the first one was too short, so about a month later I was back in, having a normal size one put in. But second time, I was so out of it from low electrolytes that I didn't really know what was going on, and they were trying to rush me into surgery. And one thing we knew was we wanted no open surgeries without Dr. Sardi saying it was okay. This is a man familiar with my case. This is a man who knows what's going on inside me and knows what can and can't be done. And one thing he had told us is anything around or near your stomach is probably inoperable. And if they try to do it, that's very, very bad for you. So, they're rushing me, trying to rush me into surgery. We actually had Dr. Sardi's personal cell phone number. It's about 1 a.m. in the morning, and Lindsey's calling him, and he's just saying, oh, no, they can't do it. Why don't you have them try a stent? It's like the life of a PMP patient when you hit these little obstacles is, why wouldn't you try anything that's not open, something that's endoscopic first, and see if that works? It may be a 1 in a million chance, maybe a 5% chance. But if that 5% chance works, you're going to save yourself scar tissue, the rigors of recovery, and it makes sense if you think about it after the fact. And that time we learned the hard way, and the next time, rather than being rushed into the emergency room, it was more of a walk-in procedure.
So I know we're running short on time here, so just wanted to say, before I turn it over to Doug to kind of conclude, it was 3.5 weeks in Baltimore, 6 months of chemotherapy when we got home, systemic chemo. He's on FOLFOX. In the middle of winter, I might add. So for those of you who have gone through FOLFOX or have been a caregiver for someone who has or is familiar with it, extreme sensitivity to the cold is a main side effect of FOLFOX. And I think that it snowed every single time we had to go to the hospital for an infusion. I think the nurses, by the time that we actually got to like the 4th or 5th round, they said, it's snowing, Lindsey and Doug must be coming in. So
But
after
we didn't miss
that,
the treatment.
what we all go through, right, for treatment. So after that, the 6 rounds of chemo, a couple trips in and out of the hospital with some, little blips on the radar. I think that the point we are now is where we really focus on doing a lot of positive work with, the Research Foundation and, just raising awareness and hoping that other patients have the same kind of experience that we did with getting to the right doctors, getting the right diagnosis. And I'll let Doug talk a little bit about that.
Yeah, just briefly, in summary, where we go from here. And one of our main goals is raising awareness. And through the PMP Research Foundation and, a 600-person support group that we have going on Facebook, it's more of a grassroots effort right now, but, you have to start somewhere. I talk to people all the time that say, well, why don't we have the numbers that the Livestrong Foundation has? Right now it's not going to happen, but we can all, as patients and as people in tune with this disease, raise awareness, raise funds, if need be, to help promote it. And every little bit does count. So every year, in that light, I'll close with, we have our annual fall pub crawl coming up in New Haven. Last year we raised over $13,000 at it. It's a great day. It's going to be on October 20th this year if any of you are local to the area. And, just want to come down and see a group of people that recognizes this cancer, recognizes this foundation, and really want to help. If nothing else, it makes you feel good that there are people doing something. So, like everyone has said so far, you aren't alone. There are people every day thinking about all of us as patients, and with that, in the future, we hope things just continue to get better. So thank you for your time.